Alrighty, so we are going to begin the Medicare presentation. Welcome, I'm Michelle Lee. And let me turn on my video. Okay, hi everyone, I'm Michelle Lee. Let's get started. Okay, so Medicare. Medicare has 4 parts. We have Medicare Part A, which is hospital insurance. We have Medicare Part B, which is the medical insurance. We have Medicare Part C, which is Medicare Advantage. And we have Part D, which is Medicare prescription drug coverage. Medicare Part C or Part D is optional, but each part of Medicare has its own rules, has its own monthly premiums, deductibles, and cost sharing for services. Okay, so enrolling in Part A and B, you have automatic enrollment, and this happens if you're already enrolled in Medicare. If you're on Social Security disability, you receive benefits you receive Medicare within 25 months. You must opt out if you don't want to be enrolled in Medicare because you have some other employer-based insurance. The initial enrollment period is a 7-month period, and it starts 3 months before the month of eligibility. It includes the month you turn 65, and also 3 months after the month you turn 65. The general enrollment period, also known as the GEP, and this begins from January 1st through March 31st of each year. And the coverage becomes effective the first of the following month. There is a penalty for the Part B premium, and that is 10% for each 12-month period you were eligible for Medicare, but you did not enroll. And you will pay for this penalty as long as you have Part B, and there are limited exceptions to this. Okay, next is the special enrollment period, and that's available if you want to wait to enroll in Medicare Part B after the age of 65, because either you or your spouse was working for an employer with 20 or more employees. And they continue to have employer health plan as their primary insurance. Okay? You can delay enrollment in Part B if you are still working at the age of 65 and have benefits from a large employer. You can delay enrollment in Part B if you're retired but are covered as a dependent on a working spouse's large employer health plan. You can enroll in Medicare Part A only and defer Part B until retirement or until you no longer have or want the employer plan. And just so you know, a large employer is defined as 20 or more employees if you're on Medicare due to age, which is 65 and older, or a large employee is defined if you have 100 or more employees if you're on Medicare due to disability. So when do I need Part B? When you have health benefits from a small employer, and that is defined as less than 20 employees if you're on Medicare due to age, or less than 100 employees if you're on Medicare due to disability. When do you need Part B? When an employer's health benefits is no longer based on active employment. And this applies to both large and small employers, including COBRA. So you definitely need Part B when you're offered COBRA. And then you definitely need Part B when you are in retirement. You need Part B when Medicare is your only health insurance. Okay. Special enrollment period for Part B. You can enroll in Part B within 8 months of the end of your employer or union health plan or the end of employment, whichever occurs first. Or you can enroll in Part B anytime while covered by an employer health plan based on active working status. Okay, so it is important to know that Medicare becomes primary immediately when employment stops, even if you're continuing coverage under COBRA. So you should enroll in Part B right away. Do not wait the 8 months. COBRA or a retiree plan may not pay in full if there is no Part B, because Medicare is primary and then the COBRA or the employer plan will be secondary. Okay. And with a special enrollment period, you are not faced with a Part B premium penalty. Okay. Next, we're going to discuss Part A. Do we all remember what Part A stands for? Hospital, right? So let's talk about the cost and coverage of hospital coverage. Okay. So Medicare Part A, your hospital coverage, helps pay for hospital stays, Medicare Part A helps pay for skilled nursing facility care. Part A helps pay for home health care services. So home health care services, they can include part-time or intermittent skilled care, physical therapy, speech language pathology, and occupational therapy. Part A also helps pay for hospice care and blood. Okay. So paying for Medicare Part A hospital insurance, most people receive Part A for free, so they don't pay a premium for it. But some people have to pay for Part A. And these are people with fewer than 10 years of Medicare covered employment and who are also not married to someone with more than 10 years of Medicare covered employment. Premiums for Part A for those who have to pay could be as high as $505 per month. So if you have less than 30 work credits, you will pay $505 a month for Part A. Okay. So we're going to discuss benefit periods. Original Medicare Part A, hospital costs. So if you're in the hospital from day 1 to day 30, you have to pay, you or the insurance pays a $1,600 deductible, and Medicare pays the balance. If you're in the hospital for 61 days to 90 days, you or the other insurance pays $400 per day. Medicare takes care of the balance. In a hospital, you have lifetime reserve days. These are days you don't get back. So if you're in the hospital from day 91 to 150, you or the other insurance pays $816 per day, and then Medicare will pay the balance. If you're in the hospital for 150 days or more, you are responsible for all costs, and Medicare pays nothing. A new benefit period begins each time you're out of the hospital or have not received nursing home care for 60 consecutive days. that determines a benefit period. Okay, next we're going to talk about nursing home costs in a skilled nursing facility. From day 1 to 20, you or the other insurance pays nothing. Medicare pays all costs if you've had a 3-day minimum qualifying hospital stay. Okay, if you're in the skilled nursing facility from day 21 to 100, you or the other insurance pays $204 per day, and Medicare takes care of the balance. If you're in the skilled nursing facility for 100 days or more, you or the other insurance is responsible for all costs for room and board, and Medicare pays the doctor, therapies, and supplies under Part B, while your medicines will be applied under Part D. Okay? You must meet improvement standards for Medicare coverage. If you're deemed long-term care prior to day 100, Medicare coverage for the stay will terminate. So that's important to note. Okay, next we're going to talk about home health care. Okay, and in original Medicare, you pay nothing for covered home health care services. You pay 20% of the Medicare approved amount for durable medical equipment. Okay, and durable medical equipment can be like a cane or a walker, for instance. You would pay 20%. Okay, and you can receive home health care as long as the person is eligible. You can receive up to 8 hours per day, but no more than 28 hours per week. And to receive home health care, you must meet these 4 conditions. So your doctor must make a plan for the care that you receive at home. And your doctor must list the specific care that you need. You must be homebound, and you or your doctor will help you find a home health care agency that is Medicare approved. Okay, next we're going to discuss Medicare Part B. Do you remember what it is? I hope you said medical because it's medical. We're going to talk about the cost and coverage. Okay, so Part B medical insurance helps pay for doctor services, outpatient medical and surgical services and supplies, diagnostic tests and laboratory tests, outpatient therapy, outpatient mental health services. Part B helps pay for home health services, durable medical equipment, outpatient hospital services, blood, and ambulance services. Okay, what's not covered by Medicare? Eyeglasses, routine dental, hearing aids, long-term care in a nursing home. Medicare Part B will not pay for a home health care aid if you only need help with bathing, dressing, and housekeeping. So that falls under custodial care, and Medicare will only pay for home health care if you need skilled care, like from a nurse. Okay, so Part B doesn't cover cosmetic surgery, acupuncture, foot care, non-emergency medical transportation. Part B does not take care of home modifications like ramps in your home. Part B doesn't pay for that. Part B also doesn't pay for services you receive outside the United States. Now, it's important to note that some of the above may be covered by a Medicare Advantage plan or Medicaid. Okay. Alrighty, for 2024, the Medicare Part B premium. Most people in 2024 pay $174.70 for Part B. Social Security determines what you pay for Part B by looking at your tax returns from 2022. So if your income was more than $103 or $103,000 if you are single, or more than $206,000 as a couple, you may be subject to an IRMA charge in 2024. If you feel that you, for some reason, if you feel that you are not responsible for an IRMA charge, I will call Social Security to try and appeal an IRMA charge, because Social Security determines what you pay for Part B. So if your income is significantly less in 2024 because you're, for instance, you're no longer working, I would call Social Security to see if they can take care of that. Okay, next slide. Part B, other costs. Yes, so there are extra other costs. They have a Part B deductible. So in 2024, the Part B deductible is $240. Okay, so Medicare pays 80% for services, and Medicare beneficiaries pay 20% for most Part B services. There may also be an excess charge, and it's an additional 15% for providers who do not accept the Medicare allowed amount as payment in full. If you have a Medicare supplement policy or a Medigap, or if you have a retiree health plan from a former employer, it usually covers some or all of the costs above. Okay. Part B, co-insurance. Medicare pays claims based on Medicare's fee schedule or the approved amount for a service or item. Okay, so Part B pays 80% of approved amount for most covered services. The patient's co-insurance, the 20%, is based on the Medicare's approved amount, not on the amount charged. Okay, some services are paid at 100% of the approved amount, like for flu shots and home health care. That is covered at 100%. Next. Okay. So when you hear we take Medicare, what does that mean? Right? So doctors or providers have 3 ways to serve people with original Medicare. So you may want to ask, we take Medicare, well, are you participating, non-participating, or private? Okay? Participating or takes assignment means that you pay 20% of the Medicare rate. If your doctor or provider is non-participating, then they can charge you 35% of the Medicare rate. So they can charge you 20% and an additional 15% because they are non-participating. Okay? If you hear that they have opted out of Medicare, that means no claims go to Medicare, and you must pay the full amount. You must pay whatever the doctor charges. So that's important to note. Okay, so this is an example of a Medicare summary notice. Okay, it displays what the provider charged and what the Medicare approved amount is, and you can only be billed 20% of the Medicare approved amount. You are not responsible for the amount that the provider charged. You can only be billed based off of the Medicare approved amount. So you can be billed no more than $21.59 in this case here. Okay? You can review your Medicare claims on the internet, okay? You can register on medicare.gov. It is a part of the federal Medicare website, and it's a secure site designed to help you check the status of your Medicare eligibility, enrollments, and other Medicare benefits. It also allows you to access your claims information almost immediately after it is processed by Medicare. So if you're someone that has trouble organizing your papers, it's nice that you can create a Medicare.gov account and have everything organized online there. Next, I'm going to talk about the layers of health coverage. So we discussed Medicare Part A, we discussed Medicare Part B, and next we're going to discuss Medicare supplement insurance, and that is a Medigap policy or a retiree group health plan. So an employer or retiree health plan, you want to find out from your employer. You want to find out how it coordinates with Medicare. You may want to ask if your claims cross over to the plan after Medicare pays. If you have an employer retiree health plan, you want to know how much the premium is. You want to know, does the plan have deductibles? You want to know if it includes drug coverage. It's important to know if your spouse is covered under this retiree health plan. Okay, most plans require you to enroll in both Medicare Part A and Medicare Part B when you retire. So that's important to note too. Okay, what is a Medigap? These are policies sold by insurance carriers. They cover the cost gaps in original Medicare, like the Part A and Part B deductibles, the co-payments, and the co-insurance. A Medigap is also called a Medicare supplement insurance policy. And a Medigap has 10 standardized policies available, meaning that they are the same no matter which insurance company you choose. They provide the same benefits. And these plans are labeled A through N, and plans of the same letter have the same coverage. So if I purchase a plan N from Aetna for $100, but then they offer the same plan for $95, it provides the same benefit. Only the premium costs are different. What's great about a Medigap is that you can go to any doctor, any hospital, or provider that accepts Medicare in any state. What is a Medigap? You pay a monthly premium for a Medigap in addition to the Medicare Part B premium, okay? A Medigap could be as low as $100, but as high as $350 in addition to Part B per month based off of the plan you choose and your age. The Medigap policies pay the claim after Medicare pays. So it only covers Medicare services. It's important to note that companies can turn you down for coverage if you apply after your first 6 months with Part B. So if you're interested in a Medigap, you want to enroll in one right away. A Medigap does not cover prescription drugs, so you will need a separate Medicare Part D prescription drug plan. Okay, so this lists the different Medigap policy plans. Notice Plan G. It provides the most coverage. There's also a high deductible Plan G. And the high deductible Plan G states that you must pay $2,800 deductible before the policy will pay for any claims. Plan N is another popular plan. It's similar to Plan G. Outside of the excess charge, you see Plan N. Notice Plan N doesn't offer the excess charge, and you would pay a $20 copay each doctor visit, but the premium is significantly less. So whatever your needs are when choosing a Medigap policy, there is a plan available to meet your needs. If you notice a Plan K or a Plan L, you will pay a percentage for services until you meet an out-of-pocket amount. And they have different plans just so you can have a policy that you can afford that meets your needs. So that's why there's so many. Okay, a little bit more information about Medigaps. Take a look at Cigna. You see they have a Plan G. For a female, a Plan G with Cigna is $143 a month. Okay, if you want a Plan G, but a high deductible Plan G, you can notice that the premium is significantly less because you must satisfy the deductible of $2,800. Then you would have a $51 premium each month. But if Plan G is not what you prefer, if you prefer a Plan N, you can see that the premium is a lot less, but you have a $20 copay each doctor visit. So when choosing a Medigap plan, there are different ways that you can afford one if you want one. Okay? Now I'm going to turn it over to Mary, the director of the SHIP program. Thank you.
Thank you, Michelle. So Michelle has spoken about the original Medicare Part A and Part B and adding on a Medicare supplement to that to help with the A and B deductibles and copays. I'm going to start by talking about the Part D prescription coverage. So Michelle, there we go. So as Michelle mentioned, Medicare supplement policies do not cover you for prescription drugs. You would need to get another policy to cover you for prescriptions. And if you want the prescription coverage from Medicare, that would be a Part D Medicare prescription drug plan. So when you have original Medicare, you've got your Medicare card, a second card for your Medicare supplement, and then a third card for your Part D prescription coverage. The Medicare prescription drug plans you can get in one of three ways. The first way is to purchase a policy that just covers you for prescription drugs. That's called a standalone prescription drug plan, or a PDP for short, prescription drug plan. These policies are sold by insurance companies, the same companies that sell the Medicare supplements, companies like Aetna, United Healthcare, and Horizon Blue Cross Blue Shield. Again, they only cover prescriptions. Or you can enroll in a Medicare Advantage plan. That type of policy includes both health benefits and prescription benefits, and we'll be talking about Medicare Advantage plans after we talk about the standalone Part B. Lastly, not everyone needs to get drug coverage from Medicare. You might have drug coverage as part of your retiree health benefits, or maybe you get your prescriptions from the Veterans Administration. Those types of coverage is called creditable drug coverage, and Medicare gives you credit for having drug coverage from a source other than Medicare. If that's the case, you don't need to enroll in a Medicare Part D plan. You can continue to use the drug coverage from your union or your former employer. Here in New Jersey, we have 21 different standalone prescription drug plans from Medicare to choose from. It does differ from year to year because the contracts that the insurance companies have with Medicare are a 12-month contract. Some of the prescription drug plans are considered national plans, meaning those insurance companies offer a Part D plan in all of the 50 states. However, those plans will differ in terms of what the premium is and the drugs they cover from state to state. The prescription drug plans only cover medications that are available by prescription. They don't cover over-the-counter medications. All of the 21 drug plans offered in New Jersey have a list of drugs that they cover, and the insurance company decides which drugs in each class of medications they want to cover. That list of drugs is called the formulary. So all of the plans have to cover, for example, high blood pressure medications, but the plans decide of those category of medications which drugs they want to cover on their formulary. So when you enroll in a plan, you want to make sure that the plan covers the particular medication that you take. In addition to the formulary, the plan also places the drugs in different cost tiers. So they'll have their formulary with the list of drugs, and they'll indicate on that list, is it a tier 1, tier 2, etc. The lower the number of the tier, the lower the copay or cost will be for you at the pharmacy counter. The plans do differ on the tiers that they have, but usually the tier 1 drug is what's called preferred generics. So those generics that are on the lower cost end. Usually a tier 2 drug is called preferred brand names or non-preferred generics. Tier 3 would be non-preferred brand names and generic. And then tier 5, what they call specialty drugs. Specialty drugs are medications that either have to be made by a specialty pharmacy, or the cost of that drug is more than $300 for a 30-day supply. Also in the Part D plans, when Congress created this benefit, they did exclude some categories of drugs that Medicare plans cannot cover. They include things like prescription vitamins, cosmetic medication like Rogaine for hair growth, a category of drugs they consider lifestyle drugs that would include the Viagra class of drugs, and some others are on that list. But most medications that people take for their medical conditions or diseases are covered by Medicare Part D. In addition to the formulary and the cost tier, many of these prescription drug plans are allowed to place a restriction on how they cover the medication. And there are 3 different types of restrictions a plan can choose. One is called a quantity limit. A plan can say, well, we'll cover Lipitor, but we'll only cover 100 pills a month. And if your doctor prescribes a higher dose than that, the doctor's got to justify why such a high dose is required. We usually don't run into a lot of problems with quantity limit. Those limits are usually set very high, and most people's doses fall within those limits. The second restriction is called prior authorization. In that case, your prescription plan says, yes, we cover this drug on our formulary, but before we will approve the dispensing of that drug, we need some additional information from your doctor about medical testing or about your diagnosing to make sure it justifies use of this medication. Lastly, third is step therapy, where a Medicare drug plan will say, yes, we cover this drug on our formulary, but first we want you to try an alternative drug. Maybe you have a brand name drug and we want you to try the generic version of it first to see if it works. If it doesn't work for you, then they will step up to the original prescription tried. Now, all of these restrictions are appealable. So if your doctor writes you a prescription and the plan has, say, step therapy on it, Your doctor can appeal it to say, yes, you've already tried the alternatives and had reactions. So that's why they need that. So any of these can be appealed, and they do differ from plan to plan. Okay, next slide. So the costs in the Medicare drug plans of the 21 plans we have, the premiums were a very broad range. We do have one plan that is a 0 monthly premium, and we have some plans that are much higher on the $100 range. But the average premium here in New Jersey is about $37 a month premium for the Part D plan. Some of the plans also then have a deductible, and Medicare puts a cap on that deductible every year. That's a national cap. So this year the cap is $545. So a plan, Part D drug plan, cannot have a deductible higher than $545. While you're in the deductible phase, when you fill your prescriptions, you'll pay the full price for that drug until that $545 deductible is met. Notice it says here you pay the full cost for some drugs, because many of the drug plans say we don't charge a deductible for the cheaper tier 1 or tier 2 drugs. We only charge the deductible on the higher tier drugs. So you will see some variation in that. Once the deductible is met, then you fall into the next phase called the initial coverage period. While you're in this phase, when you go to the pharmacy to fill your prescription, you'll pay a flat copay, say $20, $10, or a coinsurance, say 25% of the cost of the drug. Each plan comes up with their own cost-sharing structure. You're going to stay in this initial coverage period until the total cost of the medications you receive for the year hits an amount of money called the initial coverage cap. And for this year, that's $5,030. So that dollar amount is the amount you paid at the pharmacy counter in your copay and coinsurance, and what that Part D plan pays towards the cost of your drugs. So it's the total drug amount. If you have enough expensive prescriptions that you're going to hit that amount during the year, you then go into the next coverage level called the coverage gap. Many people nickname this the donut hole. While you're in the coverage gap of your Part D coverage plan, you pay 25% of the cost of all of your medications. Okay? Some plans do cover some drugs in the coverage gap where you'll pay less than the 25%, but most plans have the 25% copay during the coverage gap. Now, what's good about the coverage gap is that the discount that you're getting on the brand name drugs, that's paid for by the drug manufacturers. And that amount of money on that discount counts as if it's coming out of your pocket. So you stay in the initial coverage gap until your total out of pocket for the whole year in that plan reaches the maximum. For this year, that maximum is $8,000. But remember, not all of that $8,000 is your responsibility. The discount provided on the brand name drugs in the coverage gap also is included in that $8,000. Okay? So what happens when you hit that $8,000? You then fall into the final phase of your Part D benefit called the catastrophic benefit. And for the first time this year, your copay, if you reach the catastrophic benefit, will be a 0 copay for all covered drugs until the end of the calendar year. Now, all of the Part D plans keep track of all of the spending. They send you a monthly explanation of benefits to let you know what phase you're in and how many more dollars you need to spend to go into the next phase. So you need to carefully read those statements that the plans send out to you. Okay, so you have 21 Part D plans to choose from. How can you go about picking the best plan for you? The first criteria would be the coverage. You want to look for a plan that covers your prescriptions that you're currently taking, and you want to look for a plan that also doesn't have any prior authorizations or step therapy on those medications. So that's the first criteria. Then once you narrow down the list to those that cover your drugs, then you're going to look at the cost. And you just don't want to look at premium. You want to look at the total cost to be in that plan for a whole year, paying the premium, the deductible, and all of the copays. And Medicare has a very good system on its website that calculates that for you. The third criteria is convenience. All of the plans contract with pharmacies to be in network for them. So you want to enroll in a plan that has your pharmacy that you like to use in network for the plan. In addition, the plan has a network of pharmacies. They also have what is called preferred pharmacies within that network, meaning that you'll pay a much lower copay in a preferred pharmacy as to opposed to a standard network pharmacy that the plan has. So carefully look at that as well when you're looking at the plans. Lastly is coordination. Maybe you have some other type of subsidy that helps you with your drug costs, or your union maybe is helping you to make sure you roll in a drug plan that will work with any other type of assistance that you get. Okay, so this is the Medicare website. On it, they have what is called the Plan Finder. Another click, Michelle. You'll see a little suitcase on there that says Find Health and Drug Plans. So you go to the public website, medicare.gov. You click on Find Plans Now, and you type in your list of prescriptions. The Plan Finder then sorts through the formularies of all of the plans offered in your state and comes up with you ranked which plans would be the most cost-effective plans for you covering your medications. So it's a very good website, an easy website to use to pick a Part D plan. Next slide. Okay, so what if you do your homework and you chose the best plan at that time for the medications you were taking, but now it's the middle of the year and you have a brand new prescription and you find out your prescription drug plan doesn't cover it? What can you do? Well, Medicare locks you into your drug plan for that year. You can only change drug plans at the end of the year during their open enrollment. So if you're locked in a plan and you have a new prescription that your plan doesn't cover, the first thing you can do is find out what alternative your drug does cover. So I mentioned the high blood pressure medication before. You get a new prescription for high blood pressure medicine, your plan doesn't cover that one, but they will cover other low blood pressure medications. So you can find out what they do cover and ask your doctor if it's okay to switch the prescription to one that your plan does cover. If your doctor comes back and says, no, that's the best one for you, I don't think those other alternatives would work as well, then the doctor can work with your Part D insurance company to request what is called an exception. Your doctor is going to say to your plan, cover this drug, not for everybody in your plan, but make an exception to just cover it for this member because they can't take an alternative. So the plan will consider that request. If the plan comes back and says no, there is an appeal process up to 3 other levels that you can appeal it to try and get your Medicare Part D insurance company to cover the prescriptions that you need. If you don't win the appeal during the next annual enrollment period in the fall, you can change your plan again to hopefully find a plan that will cover all of your prescriptions. Okay. So we talked about original Medicare and adding on a supplement to that and adding on a Part D drug plan to that. Another alternative you have as a Medicare beneficiary is to instead enroll in Part C of Medicare. This is a type of enrollment that combines hospital, medical, and prescription benefits all together into one plan. And this is called a Medicare Advantage plan. Another click, please, Michelle. Right. So Medicare Advantage plans are an alternative to original Medicare. You can't be in both at the same time. You get to decide how you want your benefits when you're brand new to Medicare. You decide original Medicare or Medicare Advantage. And then every fall, Medicare has an open enrollment period where you can again switch your coverage from Medicare Advantage back to original Medicare and vice versa. Okay, so let me highlight what these Medicare Advantage plans, how they work. So Medicare Advantage plans are managed care. They're structured as HMOs or PPOs. They are offered again by insurance companies, just like the Part D plans and Medigap policies are. Then they contract with Medicare to offer you your Medicare benefits. When you enroll in a Medicare Advantage plan, you no longer use your red, white, and blue Medicare card. Instead, all of your medical and prescription and hospital services will be billed through your Medicare Advantage plan. But because it's managed care now you have some restrictions. Now you are limited to only use doctors, hospitals, and labs that are under contract with the insurance company you enrolled in. Also, because it's managed care, you might need a referral to see certain doctors, and you might need prior authorization before you're able to get certain medical testings or benefits get approval from the plan. The Advantage part of Medicare Advantage is most of the plans cover extra benefits that you do not get in original Medicare alone. They cover things like eyeglasses, hearing aids, and dental services as an example. Okay? Remember, though, when you enroll in a Medicare Advantage plan, they are not a supplement to Medicare the way the Medigap policies are. Instead, all claims have to go through your insurance company that offers you your Medicare Advantage plan. The claim cannot go to Medicare. If your doctor sends the claim to Medicare, Medicare will reject it because Medicare knows you're enrolled in Medicare Advantage. Okay? When you enroll in a Medicare Advantage, you still have to pay your monthly Part B premium to Medicare. Medicare then uses that to pay your Medicare Advantage plan a monthly fee for providing you with the benefits. Some of the Medicare Advantage plans do have an additional monthly premium, but many of our plans have no additional premium. Keep in mind, though, with Medicare Advantage plans, your cost sharing is very different than you have in original Medicare. It's no longer when you go to the doctor, Medicare pays 80%. Instead, in Medicare Advantage, it's going to differ from plan to plan what your cost share is going to be when you go to the doctor, when you go to the hospital, when you get an x-ray. The plans decide what your copay is for those types of services, and they differ from plan to plan. Okay, next slide. So here in New Jersey, we have 10 different companies offering 74 different Medicare Advantage plans. It does differ from county. So if you live in Mercer County, you'll have different plans available as opposed to if you lived in Hunterdon County. The premiums for the plans, as I mentioned, many of them have a zero premium. We've got 29 plans that don't charge any extra premium. And then the other plans have a wide premium range from $30, $40 all the way up to over $100 a month. Some of the plans also have another benefit where not only will they charge you a premium, but they'll help pay towards your Part B premium, anywhere from $20 to $100 a month towards your Part B. Usually with these Medicare Advantage plans, if it does have a high monthly premium, usually $100 or more, we usually say you really should consider a Medicare supplement instead, because you're paying this high monthly premium for Medicare Advantage, and then you still have a lot of copays when you go to the doctor. So that would tend to be not a cost-effective choice. Some plans also have a deductible for some services. So for example, some plans might have $1,000 deductible that you have to pay when you have a hospital stay before the plan will pay anything. So carefully look if the plan has that feature. But all of the plans have a different copay for every different service. So they might have a $10 copay to see a primary doctor and a $40 copay to see a specialist, then $350 a day for a hospital stay. All right, so every type of service you get, you have a copay and a different copay for, and again, it differs from plan to plan. The good thing, though, about these copays is Medicare does put a cap on the copays that you can pay in any 1 year. It's called the maximum out of pocket, known as the MOOP, M-O-O-P, maximum out of pocket. It is rather high. Most of the plans' maximum out of pocket is $8,000. So if you have a year where you're very sick, a lot of doctor's visits, a lot of hospital stays, and you have to pay $8,000 out of your pocket, at that point then, that's your maximum, then the Medicare Advantage plan will continue to provide you services for the rest of the year with no cost to you. The plan would cover it at 100%. Okay, This should be a familiar slide to you, the Joe Namath commercials and other celebrities that advertise on television for Medicare plans with extra benefits. These ads are for Medicare Advantage plans. Sometimes they don't use that word. They'll just say, call this number now. You're missing out on benefits. But that's what they are selling. Those phone numbers link you to insurance agents that'll tell you about the different Medicare Advantage plans offered in your area. Next slide. Okay. Some of these extra benefits, in addition to the dental and so on, you want to make sure you ask questions about it. Many of the dental benefits offered by the plans might just be routine dental, that they'll pay for you for routine cleaning and checkup from your dentist. Some plans do have more comprehensive dental in there, but all of them have a dollar cap. Now, the dollar cap on the dental benefit is anywhere from $1,000 to $2,000 for the year. So it's a very limited dental package. Some plans offer you home delivered meals if you have a hospital stay. Many of the plans are offering a spending card. You get a card that you can use to go to certain retail stores to buy over-the-counter items, things like adult diapers or shower chairs or cold medicine or prescription vitamins. And those spending cards vary widely, anywhere from $40 a quarter up to $400 a quarter. So great variation on that benefit. Some plans are now offering transportation to medical appointments or travel, that if you need medical services outside the US, they'll cover for certain things. So lots of variation. But if you're looking at Medicare Advantage, you want to look at something called the summary of benefits that will spell out all of these copays for all services, both medical, prescription, and the extra benefits that they offer. So if you're considering Medicare Advantage, the first thing you want to ask about is the network. What hospitals and doctors are under contract with this plan, so I know what my choices are going to be. You want to carefully look at what all the copays are for all of the services that you anticipate needing. Say you've got a knee replacement coming up, you'll need to know what the hospital copays are, what the physical therapy copays are, what the inpatient rehabilitation copays are, so you know what you're going to be exposed to. Also know about the prescription coverage. These plans include prescription coverage, and you want to make sure they check you that they cover your medications and what the costs are for that medication. When you choose a Medicare Advantage and you want drug coverage from Medicare, you must get it from your Medicare Advantage plan. You cannot both have a Medicare Advantage plan and a separate Part D plan from another company. Medicare will not allow those two enrollments to be processed at the same time. Also, how will it affect your employer or union coverage? Most employer health benefits only work with the original Medicare. If you enroll in a Medicare Advantage plan, you might not be able to use your employer coverage. Okay, next slide. Okay. Also look on those details on those extra benefits about eyeglasses and dental to know what the limits are on that coverage, particularly the dollar amount cap that the plans place on that. Okay, next slide. Next slide. Okay, so this I give you an example of comparing what your costs are, whether you enroll in a Medicare Advantage plan or a Medigap policy. So this example is what we call Mrs. Healthy. If Mrs. Healthy enrolled in original Medicare and got a Medigap Plan G, she would still have to pay her Part B premium every month of $175. Then her premium for her Medigap G, because she's young and 65, is about $140 a month. Plan G does not cover the Part B deductible of $240, so she would be responsible for that. But then when she goes to the doctor, there's no out-of-pocket cost for her once the deductible is met. She can see the primary doctor or a specialist. She had some outpatient surgery done to remove a bunion. She uses diabetic supplies. All of that is covered between her Medicare and her Plan G. Now, Plan G does not have any dental benefits. So to see her dentist for cleanings, it cost her $300 for her 2 cleanings a year. Plan G also does not cover eyeglasses, so she had to pay the full $500 for her eyeglasses. The end of the year for Mrs. Healthy, $4,820 in her healthcare costs. Now, instead of Mrs. Healthy had enrolled in a Medicare Advantage plan, she still would have to pay her Part B premium to Medicare every month, but there's no additional plan premium. She enrolled in a Medicare Advantage plan that has a zero premium. She doesn't have to pay her Part B deductible because you don't pay that when you're in a Medicare Advantage. But she did pay copays for services. So she saw her primary doctor twice. It was a $20 copay each time she saw him. She saw a specialist twice during the year. The plan has a $50 copay for that. For her outpatient surgery to remove the bunion, her plan has a $125 copay for that procedure. And then for her diabetic supplies, her plan charges a 20% coinsurance, so she had to pay that fee. The dental, she didn't have to pay anything for because her plan covers routine dental at no copay. And her plan subsidizes her eyeglasses. She only had to pay $100 for her eyeglasses. And she had some blood work done. Plan has a $13 copay for that. So Mrs. Healthy in a Medicare Advantage plan the end of the year, $2,718. So she saves significant amount of money by being in Medicare Advantage when she is healthy. Now let's look at her husband, Mr. Sick. So Mr. Sick, if he had a Medicare Advantage plan, you see that his out-of-pocket costs really add up. Because he had a lot of doctor's visits to both his primary and his specialist, he had a hospital stay in there, and the plan has $295 per day for the first 10 days. Then he had to go to inpatient rehab. They charge $125 for the first 10 days. Ambulance ride, emergency room visit, so a more significant outpatient surgery. She had some physical therapy there. So all of those copays in his Medicare Advantage plan, end of the year, close to $9,000 worth of out-of-pocket costs. If instead Mr. Sick had stayed with original Medicare and had a Medigap Plan G, his monthly premium in the Plan G, because he's a male, they pay higher rates. He paid $160 a month. And he had to pay that Part B deductible, but then all of his doctor visits, hospital stays, nursing home stay, ambulance ride, everything was covered between Medicare and his Plan G. End of the year, his out-of-pocket $5,000. So he would save significant amount of money by going with the Medigap policy. So bottom line is, in healthy people, Medicare Advantage is more cost effective. When you're not so healthy, Medigap policy is more cost effective. The problem is we don't have that crystal ball to know what our health expenses are going to be the next year, right? So when you have to make this decision in the at the end of a calendar year for what you're going to have the following year. So I'm just trying to explain to you, how things can change very quickly, your exposure to out-of-pocket costs if your health does take a turn. The other thing about this is, say that when you are young and new to Medicare and you're healthy, you go with Medicare Advantage. If then you develop some health conditions as you get older, you cannot switch to then a Medigap policy. As Michelle talked about, after you've had Medicare for 6 months or more, then the insurance companies can ask you medical questions, and they feel that if you're too sick, they can turn you down for a policy. Okay? Not all states have this rule. In New York, they don't have that rule that they could turn you down, but in New Jersey, they do. So know ahead of time, if you get a Medigap policy, you can only switch to Medicare Advantage, but you cannot make the switch the other way around. Okay, next slide. Okay, the enrollment periods for the Part D drug plans and Medicare Advantage plans. So I said you can make that choice when you're brand new to Medicare. Then every year in the fall, between October 15th and December 7th, is open enrollment, where you can change your Part D plan, change your Medicare Advantage plan, or switch between original and Medicare Advantage. Medicare also gives you another 3 months in the beginning of the year from January 1 to March 31st. If you're in a Medicare Advantage plan, you can switch to a different one or leave it all together during those first 3 months of the year. Then there are some special enrollment periods that allow you to change your coverage. Things like moving out of the state or moving from one county to another. Or maybe when you retired, you had a retiree health plan, and now that company went bankrupt and you're losing that retiree plan. That would give you a special enrollment and to enroll in something that Medicare has. Okay, so lots of special circumstances that would allow you to change your coverage. Okay, next slide. Okay. Lastly, just talk about some programs we have to assist people who have limited income. Next slide. First, we have some programs that help you with the Part B premium. Remember, that's $174 and change per month. That program is called Specified Low Income Medicare Beneficiary, known as SLMB, SLMB. This in 2024, your monthly income, if you're single, must be less than $1,695. When I say income, I'm talking about the gross amount of all income you have coming in, the gross amount of your Social Security, gross amount of any pension that you're collecting. If you're working, your employment income. If you're collecting alimony, your alimony income. All sources count. There's also a resource cap with this benefit. If you're single, that resource cap is $9,430. What's a resource? A resource are your checking account, savings account, certificates of deposit, and IRA. Those things all count against that resource cap. The home that you live in, if you own your home, is not considered a resource, so they don't consider that towards that cap. If you qualify for the SLMB program, they will pay your Part B premium. So that means that you get an additional $174 to take home in your Social Security check to use for your other living expenses. Now, these are the New Jersey SLMB limits. If you live in Pennsylvania, you need to check to see what their limits are. Might be different than the New Jersey limits. To apply for this program, if you live in New Jersey, it's aging.gov. Aging.nj.gov is the website and the phone number there to call to apply. Next slide. We also have in New Jersey 2 pharmaceutical assistance program. One is called PAD, P-A-A-D. And these are the income limits for PAD. They're very generous limits compared to the SLMB program. Same source, the same way, all sources of income counts, but there is no resource cap. So they don't look at your IRA amount or certificates of deposit or your savings account. They do count interest that you earn from those resources towards your income, but the capital is not. If you qualify for help from PAD, when you go to the pharmacy counter, you'll pay no more than $5 per prescription for generic drugs, no more than $7 per prescription for brand name drugs. The PAD program works with Medicare Part D. They pay the premium for your plan for most of the Part D plans. They pay the Part D deductible copays and all those coverage gap costs. You pay no more than the $7. Okay, next slide. Then finally, we have another prescription program called the New Jersey Senior Gold Prescription Discount. This program has an even higher income limit, so many individuals can qualify for this help. If you qualify for the Senior Gold discount, you pay the first $15 of the cost of your prescription, and then Senior Gold pays half of any balance above the $15. Okay? Senior Gold does not pay the premium for your Part D plan, but you are required to have a Part D with the Senior Gold. To apply for any of those 3 programs, the SLMB, PAD, or the Senior Gold, it's all on one application. That application is called NJ Save. You can do that application online, or you can call that toll-free number there on the slide to do the application over the phone or have a paper application mailed to you. Okay, so just some last reminders about Medicare, what we went over with today. Okay, please avoid any scams, particularly if you are turning age 65. You are going to be getting lots of phone calls, lots of things in the mail trying to get your business. Please know that neither Medicare or Social Security will call you at home. They will not ask for your bank information or your Social Security numbers. Those are scammers. Please protect your Medicare number just like you would your credit card number. Okay. Also, Medicare does not send representatives knocking on your door. Those would be sales agents trying to sell you some policies. So be very, very leery of any unannounced visitors to your home. Okay, next slide. Lastly, a word about our program, SHIP, State Health Insurance Assistance Program. We are a program funded by the federal government to help people navigate through the Medicare program, both to help you understand how to enroll in Medicare, how to choose your plan options for coverage, and once you're enrolled, any help with claims or enrollment issues that you have. The program is free. Our counselors are unbiased. They're not going to recommend one insurance company or one product type over the other. If you live in New Jersey, that is our New Jersey Medicare hotline on the screen. Pennsylvania also has a program similar to SHIP. They recently changed its name. It's called something else there. I believe it's called MediPA. So they have a similar program for New Jersey residents to go to a local counselor to navigate you through your Medicare choices. All of the charts of the plans we talked about today are on our New Jersey website, the Medigap policies and Medigap companies, the Part D plans, and the Medicare Advantage plans are listed there on that website on your screen. Okay, so now we can take any additional questions. Michelle, I see you've been manning the chat. Is there anyone who wants to type in an additional question, or perhaps you'd like to raise your hand and we can advise you to unmute yourself to ask a question over the phone?
And I thank you very much for your presentation. I just want to remind everybody to complete the survey that's found in the chat box.
Okay, very good. Thanks, Maggie. Okay, so again, in the reactions button on the bottom of your screen, the little smiley face, if you click on there, there should be a raise your hand feature. If you want to raise your hand to ask a question over the audio, or again, use the chat feature to chat anything in. Well, everyone got shy. Okay, I see something coming in here. Question, can someone have too much coverage? My parents have Medicare A and B, an Advantage plan, and a Plan F. Okay, that is too much coverage. That Plan F only works with the original Medicare. So your parents are paying a premium for Plan F. They're not getting any benefit out of it. All claims are going to that Medicare Advantage plan and are not going to the Plan F. So your parents need to decide to drop one of them, either drop the Medicare Advantage plan or drop the Plan F. Okay, to do that, I suggest you call one of our SHIP counselors to see about their particular situation, to see what would best option for them, and to go about dropping one of them. The Medicare Advantage, they might be locked into it until the end of the year. So we'll see if they qualify for some type of special enrollment. So I'd encourage you to call to your SHIP program to talk about that situation, but definitely something needs to be done because they have too much coverage there. What are the plus plans? I think you're talking about the cost plus plans. Those are another type of Medicare supplement policy. They are not offered here in New Jersey, so we don't educate on them. I don't know if they're available in Pennsylvania, but if you want information on the cost plus plans, you can call 1-800-MEDICARE for the state you're living in, but they are not offered here in New Jersey. Okay, the slides were emailed out to everyone who pre-registered for today. Maggie, where can they email to if they did not get a copy of the slides?
They can email to me. I can put my address in the mail in the chat box, and they can get that.
Great, thank you. Another question came in. Do you have to stop contributing to an HSA while still employed? So that's a good question. An HSA is a health savings account, and that is a pre-tax type of contribution. If you are working and you have a health savings account, you do have to stop contributing to that if you are going to enroll in Medicare Part A. So if you're still working when you're turning 65, you need to decide either to delay enrolling in Medicare Part A and keep contributing to the HSA, or enroll in Part A and stop contributing to the HSA. So you can, again, call SHIP will give you more information about that, but there are some tax considerations about that. Okay. Okay, so someone typed in, they called AARP and they offer a plus plan. Okay, so I believe what you're talking about, AARP has a Medicare supplement policy that includes some preventive benefit. It's not a cost plus plan. They have Medicare supplement benefit that includes what they're calling wellness benefits. So they offer their Medicare supplement policy holders discounts, it's not insurance, but discounts on dental, eyeglasses, and hearing aids. Okay, so United Healthcare does offer them. They're called wellness benefits. It's not a cost plus plan. Okay. Any other questions for Michelle or Rob? Okay. If you could go to the next slide, Michelle, I think just one more time, our toll-free number. Okay, that's right. So one more time. Whoop, we lost it. Here we go. One more time. This is our Medicare helpline for those of you who live in New Jersey. You can call 1-800-MEDICARE to get the similar number for Pennsylvania residents. And again, feel free to call us if you have any additional questions you didn't think of today, or if you would like to make an appointment with one of our SHIP counselors in the location where you live. You can call our helpline. We'll give you the number for your local SHIP. Okay. Michelle, anything else you wanted to add?
No, I think you covered it all.
All right. Well, thank you so much, everyone, for joining us today. I hope you found this session helpful. And as Maggie said, please do complete the satisfaction survey to give feedback about how this presentation was able to help you in any way we can improve it.